Thank you all for joining us, and we really look forward to getting some industry-wide ideas on what can be done on something which most people view as a relationship between a patient and their doctor, and they're the ones deciding, they're the ones asking. But why we are having Preserve the Uterus conferences to create awareness. The awareness is lacking on what are the options available for women. And this is what we're trying to understand, whether the industry has a role to play in creating this awareness. So, Mr. Chopra, let me ask you first, what is the significance of the initiatives on women's health awareness, and does it really have an impact on their overall health as well as their place in the community?
Okay. So good afternoon, everyone, and thank you so much, Anisha. So I'm not too sure sessions post-lunch or pre-lunch are more challenging, for the audience as well as for the panelists. So Anisha, you asked me about industry's perspective, industry's role in raising the voice of patients as well as kind of contributing towards this cause. So in Bayer, so for the last 9 decades, 90 years, we have been a pioneer as a women's healthcare company. So as a global leader in women's healthcare, so it is not only coming out with innovation in terms of products or brands, but it is something beyond that. So our thought process possibly is, how do we kind of identify a problem statement and try to weave around solutions towards that? Probably product, innovation is a part of it. So this Preserve the Uterus basically was one trigger which came to us. Since morning we have been listening about women, how important women is in the society, for the family, for the society as a whole. And a country of 1.4 billion people and 50% are women. So you can understand the importance and significance of health of women in this country. So with the problem statement, how do you address it? Address it as a pharma company, definitely we would have a lot of limitations. So basically weaving around a lot of partnerships, collaborations, and in this case, we have collaborated with Foxy. We all know this is the largest doctors body in the world with 40,000 gynecologists as members, and also IHW Council. So I think spreading awareness, spreading education, and credible information is the most important thing. Today in the world of Google, we get a lot of information, but what is the right information, what is the correct, credible information, especially in the field of medical science, becomes very, very significant. So we thought, okay, fine, so like-minded partners with their own expertise should come together and kind of build up an ecosystem where you not only just spread education, not only spread awareness, but kind of make it so inclusive that the society at large comes with this movement and it becomes a very sustainable kind of a program. So this is our contribution towards an outlook towards Preserve the Uterus and women's health as at large.
All right, Deepak ji, thank you so much for talking to us about the entire campaign and what is the basis behind it. Dr. Arundati, I want to come to you. Now we're talking about Preserve the Uterus, but we would not talk about this if it weren't for issues women face when it comes to menstruation in our country. We thought the Swachh Bharat campaign has happened, now there are toilets in every home. Why is this a big deal? I mean, menstruation normal, I'm sure there are means to address it. Why does it become a problem for women? What have you seen in your experience?
It's a great question and it requires a long answer, but to cut it short, I think that there's in general, in our country, but in actually countries across the world, a great discomfort with women's biological processes. So whether it's menstruation, biological discharge, childbirth, I think there's just a culture of silence and secrecy around women's bodies. I think what's particularly unique about menstruation is that it is something that is happening to all girls and women and other people with gender diverse identities who have a uterus and who experience this, and they experience it right from their adolescence to middle age. So you're looking at 30 to 40 years of experiencing something that's going to happen every month, and it's a completely normal biological phenomenon that, yes, is related to your reproductive capacities, but also has other functions, as I think that we heard earlier in the session, that it has a role to play in terms of the hormonal balance in the in the body. Now, I think for centuries, in our country and in others, the idea of menstrual blood has been seen as impure or dirty. And there's been a lot of lack of awareness around that, and that has resulted in a number of issues that we're facing. So I don't want to delve too much because I think everyone knows that. Now, what we're seeing in our country is, why does this continue to be an issue, despite the fact that you've pointed out, right? We have access to sanitary pads. We've got government schemes that have provided sanitary pads. We have a very vibrant marketplace where you have a wide variety of products that are available right from 20 rupees a pack right up to 300 rupees a pack or 700 rupees a pack. So we have a lot of variation. This continues to be a problem for several reasons. One is that awareness on what menstruation is still low across classes. People still don't know that the source of menstrual blood is the uterus. People still don't know what a menstrual cycle is. You can ask a child studying in an elite school in Delhi, and you can ask a child studying in an ashram shala in remote Maharashtra. But that basics of our understanding of what's happening inside the body, why does this happen, whether it's normal or abnormal, still continues to be a big gap that we're facing. Our approach to menstrual health and hygiene has been product provisioning. Give a product and it will solve the problems, because that was what was identified as an easy to address issue. And while that is a critical part of menstrual health, it is insufficient. One is that it's important to give products, but we're not reaching everyone. We're also not giving products of choice and what suits a person's body or a person's needs. But that product provisioning is also not always accompanied by sufficient information and behavior change that enables them to use that product in a proper way. So let me ask you, how many of you think that sanitary pads are a hygienic product? How many of you ask you? It is how the product is used. Imagine a girl using that same sanitary pad by Whisper, like a really good company, high-end product, costing you whatever, 265 rupees a pack. She uses it for 15 hours. Do you still think it's hygienic? No, it's not. So it is not enough for us to give a hygienic product. It's also important for us to tell you how to use it hygienically, how to maintain personal hygiene, and whether she has access to toilets and water, information, support systems to be able to do that. So I think for a variety of these reasons, we're still continuing to see, one component of menstrual health, which is menstrual hygiene, continues to be an issue. And because of this larger culture of silence around our bodies, it's not just about periods, it's about our bodies, that we're not able to get that kind of information across to really make a change.
So who's going to talk about this? I mean, I want to ask Dr. Khera, who's going to talk about this? Families में बात नहीं करना चाहते, जब बड़े हो जाएंगे खुद समझ जाएंगे, पापा से बात नहीं होगी, मम्मा समझा देंगी, फिर मम्मा तो सिर्फ उतनी बात समझाएंगी जितनी ज़रूरत है, तो कौन बात करेगा? क्योंकि when women are pregnant, they'll go meet the doctor will tell them 1,000 things, the conversation happens. After pregnancy, there goes the conversation. कौन बात करेगा?
No, absolutely. I think today we are talking about a topic on reproductive health. And menstrual hygiene is, just one small piece of so-called the reproductive health. And it is, rightly said that the reproductive health and right is, fundamental for health and well-being of the women and girls, and also for the women empowerment. So when we talk about, the reproductive health, there are a number of elements like, when to become pregnant, when not to become pregnant, how to space your children, and then, things like, getting abortions done, where to get it done. I think reproductive health has a, gamut of, interventions. But today I think we are focusing on one small piece, which is called as the menstrual hygiene or menstrual health. And we are all aware that menstrual health has a lot of, health implications. I don't know how many people are aware of, but there are a number of, health implications, which could be in the form of, the menstrual products or the so-called the sanitary pads, they are not properly used, it can lead to infection, and infection can really create a big problem in future. The woman can become, infertile forever, The infection can go to the fallopian tubes, can go to the uterus, infection, and then infection can, block those tubes. So I think it has a very wider implication. It is not only just a simple hygiene. I think the menstrual hygiene has to be practiced. And in order to, practice menstrual hygiene, like the question you raised was, who will, take the responsibility? And I know that particularly, talking about, menstrual hygiene or menstrual health, there is a lot of, stigma attached to it. Even, I used to work in the Ministry of Health, and we were running a big program on adolescent health program. And within the adolescent health program, we identified teachers to talk to the girls about those menstrual hygiene. And it was shocking that, teachers are not comfortable in talking to the girls about menstrual hygiene. They are not comfortable. And even same is the case even with the parents. Parents are not comfortable. So I think, we have to break that silence. That silence has to be broken. That's why, a lot of, attention being done in the area of adolescent health, adolescent reproductive health, and the menstrual hygiene is, one element of it. So that means that silence has to be addressed. And that silence only can be addressed when we, engage parents, engage communities, engage teachers. And we have to say that, you have to be confident in talking about these things, even sexual organs. And I have seen, when teachers talk to the girls, they will ask, boys to go out. Why should boys be out, I mean, they should also know that this is, the kind of the anatomy of the woman, and this is the normal menstrual period, which happens. Because we are trying to keep boys away, we are creating more stigma to it. I'll give you one example in the context of reproductive health. You must have heard about the disease called HIV/AIDS. Now, HIV/AIDS is also a part of that sexual and reproductive health. If you do not have a right reproductive health knowledge, you can land up in sexually transmitted diseases. You can land up in diseases like HIV. And then when the HIV program was there was a talk about use of condom. Condom is like a vaccine. If you use condom, then you can prevent HIV infection. You can prevent STI infection. So what happened in order to address this stigma, country like Thailand, who used to have a very high prevalence of HIV infection to the tune of 20%, they did a routinization of condom. They in the nursery schools, I was very shocked to visit, some of those nursery schools. They were asking small children to wear the condoms and do some paintings. And the purpose of, is basically normalized. Like, like a toothpaste, you can start, keeping toothpaste in the corner of a room, You are trying to create stigma around it, I know you go to a chemist shop, you say, I want sanitary pads. They will put in some kind of, black packet, Nobody will see what you are buying, what you are taking. I think these are these small things which we do not do intentionally, but unintentionally, we are trying to create that environment of stigma. And I think these are these simple things. If they are told to the pharmacist, told to the parents, told to the teachers, that, bring boys together, boys and girls. This is your anatomy. Boys have a night emission maybe, the girls have a menstrual cycle every month, So those things have to be taught. So I think we'll be able to make a lot of change in those stigma reduction.
Deepak ji, want to ask you, as a company, you are spearheading this campaign to create awareness. But there are restrictions on companies on what they can say about products if they have a direct interest in a similar product. Now, Arundati said if a pad is hygienic, but if you're wearing it for 15 hours, it's unhygienic. So companies that are selling pads have the interest of selling the pad. Are they talking about the right usage, or how it will benefit you, how to use it? Should they also bother about this, or should you do this? You may not have a direct product to address this, but you're doing this because you want to create awareness. Who should be talking? Because products, placement, social media, cinema, they're right in your face. Even if nobody is at home is talking to you, all this is talking to you. So are companies thinking of this, that we must do the talking without breaking the law?
Right. A very good question, actually, Anisha. Just to inform you that for this initiative, Preserve the Uterus, even though we have a brand which is directly, indirectly associated in preserving the uterus, But to many of you, you will be surprised that we haven't used the product as a feature of this whole movement. Yeah? And the uniqueness of this whole program and movement is that the doctors, the gynecologists themselves have started linking the whole initiative to something which is so non-invasive, so modern. And in the morning also we were talking about Myrina, we were talking about LNG IUS, intrauterine system, yeah, which is so modern that, in 24 hours, only 20 micrograms of hormone is released, that too locally inside the uterus. So it doesn't have any impact in the systemic circulation without any side effects. And this post-insertion remains for 5 years. So you can just imagine the precision of the technology, the advancement. After insertion, this whole system remains for 5 years. So we don't link our product to this, but yes, education, awareness, and how do we train and build up the capabilities. So last year, or in fact this year, 2023, we had shortlisted 70 medical colleges. It is not only the scientific CMEs or programs for the thought leadership or for the healthcare professionals, but we have trained around 5,000 doctors in these medical colleges for the insertion techniques. We have also trained the PG students, what we were talking them, catch them young. It is not only the trained doctor themselves, but yes, the budding doctors and coming up doctors can also. So at a large, you need to make a ecosystem which probably, will kind of address the cause.
Wondering if I can respond
Yes,
to your
yes,
comment
go
very,
ahead.
very, very quickly. So I think there's a kind of a tight line that large companies and in fact even small and medium enterprises that are producing pads and other kind of menstrual products are towing. One is they're trying to respond to consumer demand. I see a number of women here. How many of you want a pad to last you longer than 4 hours? How many of you want to use that same pad for longer? Yeah, right? Because we're busy. You're traveling, you're in college, you're in classes, you're working. Having to change a pad every 4 hours can be difficult and sometimes it may not be possible. How many of you want the pad or you to have a sense of dryness? You don't want to feel wet. You don't want smell. Now, these are things that me as a user, you as a user, we want these features. We want comfort, we want durability, we want leakage protection, right? And companies are trying to respond to that, and so now you have 12-hour duration pads, you have nighttime pads, you have pads with added scents, you have pads which are super absorbents. Now, this is the innovation in order to meet real needs of girls and women and other people who menstruate. That's real. But I think what we're struggling with now and what we haven't been able to balance out with our Bureau of Indian Standards, we have standards for menstrual products in the country, is this thing of these additives that are being put in and chemicals that are being put into these products and what they do to the body. So there was a recent research that came out last year from Toxics Link which showed that there were high levels of chemicals which are endocrine disruptors, which when we're using these
those are
commercial
everywhere, that's in your shampoo, that's in your lipstick,
Yes,
and
but
that's
this is
a
being-
whole new thing.
But this is being used very close to your body, right? So
Yeah, you're ingesting your lipstick every
and
time
the
you put it
vagina
on.
is a highly absorptive organ. I think, doctor, so you would agree, right? It's a very absorptive organ. So the thing is, we haven't been able to push the industry to disclosure. So we have standards. Our standards are fairly good, but in terms of disclosure of raw materials, especially of additives, that we're not able
I
to
think
push them
that
on.
is still a higher level to reach. We are talking about starting the conversation and who is at best positioned to do this. What do you think, Arundati?
Actually, companies are doing it. We've actually seen that when you have advertisements by companies, how many of you have seen the Sirona ad? Sirona is a company that has been, it's one of the biggest producers of the menstrual cup in the country. They have they've got a vending machine outside T2, the airport terminal. They've also got fantastic ads, which are really, these companies can really play a role in putting the issue out there. Yes, they're promoting a product, but when positioned well, and with the right messaging, they can actually begin to take steps to break some of these taboos. I'm not saying that all of them do it well, but I think that there are ways to do it. We've also seen, you mentioned mass media. Well, Padman was a great movie. right? We may not have agreed, some of us may not have agreed with the public messaging, but at the same time, it brought a conversation to people's homes because it had Akshay Kumar in it. So I think mass media using these companies, in addition to what Sir has already pointed out, at a community level, in homes, by Anganwadi workers, Asha workers, teachers, yes, we need to get that conversation going. But we can't reach everyone that way. But with mass media, with advertisements that can be powerful, and if we can work with these companies to create more positive, right messages, I think there is an opportunity for us to explore there.
Dr. Khera, what role do you think doctors are going to play here? Because, we're going to the doctor when you have a problem. But we are talking about awareness now. We're not talking you have a problem, this is how we fix it. Will doctors also need to proactively talk to, young girls? Where will they get this platform to talk to young girls? Because they generally, in their course of working with pregnant women or women who have, health issues, do they need to be involved? Will I believe a doctor more than I believe a company telling me, oh, buy my product, it's had this, ye to chepre apna saman. Should I believe a doctor? Should I believe a company?
No, obviously I think doctors have to be believed. There's no doubt on this point. But the point here is, how many doctors have enough time to do the counseling part, to do that kind of explanation. Because as on today, the most of the doctors, whether they are in the public health system or in the private system, they are just writing, prescriptions, You come with a problem and then they give you a solution. But, having periods or asking questions on menstrual hygiene, nobody goes to a doctor. So that's why, keeping, this requirement in mind, the government, came up with the program, Rashtriya Kishore Swasth Karyakram, where teachers have been trained, even in the school curriculum, these things have been incorporated. And similarly, there are kind of a dedicated adolescent clinics have also been set up, and even doctors are also being taught to do a, counseling of the youth. Because generally, youth population or the adolescent population, they are healthy people. They need right information at the right time. They are not sick. They want information. They want to ask questions, whether I can use this product, whether I can use, kind of a cups, or I can use this product, for how long I can, keep this pad. All those questions, But I think doctors should have enough time. But generally, because doctors do not have time, there is a lot of scope and a potential for, counselors. That's why, across the country, I know, in most of those facilities, a dedicated counselors have been put, And the job of the counselor is, to spend time with the adolescents, talk to them. And even I think teachers need to take a proactive role in terms of, doing a counseling. Talking about, menstrual hygiene, and they also need to be capacitated. It is not that every teacher is a kind of a competent to convey, messages or convey, all the important questions, So I think, to my mind, I think we need to really bring that in the form of a big mission to do a kind of advocacy around the menstrual hygiene, and using all those the avenues of teachers, the doctors, the community members, community health workers, and maybe in the schools can be the school monitors, they can also take that kind of a responsibility. I think this message has to spread very fast. I think we have spoken about the product, but one of the another important critical area is, disposal of this product. I know because this is at one point of time, there was a plan by the government to start a menstrual hygiene program in a big way. And then we came to a point that how will you dispose so many menstrual hygiene? If you can make some calculations, how many women and girls are menstruating, and if every woman and girl start using these sanitary pads, how much is going to be, that disposal, It's going to be in millions and millions, So how to dispose of, That's why the discussion started in terms of, why can't we think of, biodegradable, products. And I know companies have done some innovations. Companies are trying to come up with innovative products, which are kind of a biodegradable. Use it and then they are biodegradable. So, but till today, as my understanding is, We do not have any product, which is biodegradable as on today.
But we
And
have
I'm
a
also-
reusable menstrual cup.
Yeah, menstrual cup could be reused.
Yeah.
That's the possibility.
But the problem is
Yeah.
not many people know about it.
Yeah.
Like if our mothers have not used it, why will they tell their daughters to use it?
Yeah.
So that's a problem with newer products
Yes,
and
obviously.
innovation.
Yeah.
Deepak ji, wanted to ask you, Dr. Khera is talking about education starting and awareness starting from very early on. How about the doctor community and the medical community? They are busy, like Dr. Khera said. They don't have the time to counsel you so much. They're so busy, they perhaps don't even have the time to keep up to speed with what new things are coming up, where you could prescribe a medicine instead of a radical surgery, or the other alternatives that come up. So how do they come to know? How does this capacity building happen, and how critical is it for the doctor to be able to then, inform their patients, because the patients themselves may not know. They are themselves like, why should I go for this? पता नहीं कैसे काम करता है, आप क्यों ये बोल रहे हो? So how do you build this capacity?
So Dr. Khera was very correct when he mentioned about the lack of time what doctors do not have, especially in a setup in a country like India, both at the public hospital as well as in the private clinic. Because we are aware, at least in the gynec segment, if you go to Safdarjung Hospital and in each OPD, probably one doctor would be, seeing not less than 100 patients a day. So where do the doctor has time for counseling, right? And similarly, in many of the private setups also. So being a leader in women's health care, Bayer is in the forefront of conducting a lot of scientific activities at a smaller level, at a larger level, beyond metro cities, in tier 1 and tier 2 cities. So our strategy has been to have multiple partners and use multiple channels in reaching out to the society at large. Of late, of course, we all know that social media is playing a very important role, mass communication. But yes, the information has to be credible. So what we do is, we have a lot of thought leadership among the gynec community who basically becomes ambassador to the science, not the product as such, in creating a lot of awareness to the junior doctors, other doctors in other geographies. So, and second important aspect, what we have just initiated is kind of, leveraging on expertise of various segments, especially like having a PPP model, public-private partnership. So we are in the final stage of, getting into an agreement with a couple of state governments where the doctors will be trained at the district level. And probably, and the patients on those geographies in these districts will get the benefit of the modern methods, what are available.
But Deepak ji, you are working with the medical community. Are you also keeping a track on what are the outcomes? And do you plan to do this on a longer term? नई चीज़ लेके आए हैं, डॉक्टर्स भी आपके साथ हैं, पर आप patient outcomes देख रहे हैं कुछ सालों तक? Are you going to also track on what is the outcome, etc., and then maybe give it an even bigger platform if the outcome is good?
So see, there is no, I would say, fixed mechanism or measurable KPIs as such. But as I mentioned, like for example, we set our own KPIs and targets that how many doctors this year we need to train, how many areas which were untouched by us probably need to be penetrated. So increasing the reach, training the doctors, conducting a lot of scientific activities, and of course, internally if we see, the usage of that product is getting increased. So that becomes one of the indicators that yes, it has been accepted and more users are coming into the picture.
Arundati, menstrual health to many seems like a tightrope walk. Like we're telling companies, talk about it. अगर आपका product है तो ठीक से समझाओ. But there are other companies who want to be very sensitive. We'll give you period holiday. And then some people say, what is this? Women are as equal as men. What is this period holiday? What have you seen in your experience? Do women need holidays, especially those who do suffer from heavy bleeding? And should this become common practice, that workplaces are more sensitive to the needs of women, because then they fall into the trap of, you're biased when you should be more equal?
I think, first of all, I think women are asking for holidays because holiday for us means that you actually get time off to do something that you enjoy. But here it's a leave because you are you're undergoing symptoms which are difficult for you to deal with and are significantly interfering with your ability to be productive at work. I think the notion of period leave or menstrual leave, there's a lot of debate around it, but it's also understood very differently. One is that we oftentimes think it's for people who have very severe menstrual symptoms, whether it's premenstrual symptoms or what we also now have, which is PMDD, which is a more serious disorder related to the menstrual cycle and periods. You've got heavy bleeding, which may be PCOS, endometriosis, or any other condition, underlying condition. But you also have other forms of uterine bleeding, which can cause significant disruption to women's lives and their ability to be productive in life. You've got perimenopause, where women undergo significant symptoms. Some women, not everyone goes through it, but several women do undergo different kinds of symptoms. So when we look at the concept of menstrual leave, it has to look at needs of women across that life course. Right from the time that they are young adults entering the workforce, right to the time that they may be mid-career and even senior professionals because undergoing perimenopause. The conversation needs to, I think organizations need to be sensitive to what those needs are. They can consider leave, and there are various forms in which I'm seeing leave be taken over. One is that everybody can avail of that leave. It's a part of the policy. Others do it more discreetly, that if you need to take it, no questions asked, you take it, and it's a matter of respect and just mutual decision between a line manager and an employee. And then there are other companies who have towed a hard line saying, just put it under sick leave. It's not something that we can consider. So I think organizations need an HR departments or diversity, equity, inclusion units within the organization need to figure out with their employees, with their female employees of different age groups, what needs to be done. I think it's also not just an issue of leave. There are many of us who may not have menstrual symptoms that disrupt our ability to work. We may have PMS, but it doesn't mean that we can't come to work. We may have some pain in periods, but it doesn't mean that we can't be at our desk and be productive or travel for work, etc. But it doesn't mean that we don't need access to toilets. We do need. So there are certain provisions like access to toilets, perhaps having access to emergency products in case you're not carrying something in your workspace, which has to be across the board. In addition to additional provisions such as maybe a restroom, a place where someone can lie down during the workday in case they need it, provisions of menstrual leave, which within an organization we need to have these discussions and see, do we want to give this to our employees? But that discussion needs to be had. And as an organization with affected employees, we need to make sure that that policy is there. But it has to go, it can include menstrual leave, but it has to go beyond to looking at other menstrual needs of this. I've also heard, just one last point is that sometimes they also do awareness workshops at the workplace, so that is not just the women, but also the male employees who understand symptoms of menstruation, symptoms of perimenopause, so that they're just more sensitive towards their female colleagues, as well as colleagues with other gender identities who have periods. And just understand that. We're not asking them to cut us any slack, but at least you understand what's going on. Similarly with maternal, maternity benefits and so on.
Dr. Khera, do you have a view? Do companies and the workforce need to be more sensitive to this time of the month for the women? And do we need to have a conversation around this as well?
Absolutely, as an organization, as an organization, our mission is like, we talk about gender equal world, and we are really in favor of, I think, promoting these practices at workplace, and that is the way forward in terms of, gender equality. So I think we must take proactive steps, maybe at the workplaces, or maybe even in the schools and the colleges, It is not only workplace, because adolescent girls, young girls, and you all must be aware. I mean, a lot of, school absenteeism happens, across the country. And it is particularly in the rural schools, where they do not have a toilet. So can you imagine a girl who is menstruating and for 4 or 5 days in a month, she doesn't go to the school. Why? Because they do not have a separate washroom, or even if the washroom is there, it is difficult to close, or sometime water supply is not there. So I think a lot of school absenteeism also happens. I think we have to take a real holistic view of creating that kind of enabling environment for all women and girls to address their reproductive needs. And this is one of the important reproductive needs which we must be sensitive to it.
Deepak ji, could you dwell on the role of building strategic partnerships and capacity building for women's health? Why I'm asking you this, because you're working with Foxy and you're working with gynecologists to work on a solution which is going to be easier for many women when they are faced with heavy bleeding, etc. Now, let's say seeing the need of the hour, we have a company that is coming out with an innovative product, but they don't know how to get it across. How do they build this strategic partnerships? Who do they look out for? How can they do this? Any tips that you have?
Yeah, as I mentioned, even we also realize that as pharma company, we have our limitations, right? So we can just reach out to doctors and not beyond that. So and this was a journey and a learning through this journey. So we thought we need to identify potential partners who have that kind of an expertise. For example, in this case, like we are partnering with Foxy, of course, because that is the doctor's body, what we have in this country, and IHW, for example, yeah, because IHW has their own expertise in their respective field. So it is like, how do we bring about more synergies? How do we bring about more efficiency in the system? So as Dr. Khera was mentioning, how you develop a holistic approach. So that is one way we can approach and reach out to more and more number of people in the society. So another example I would just like to mention is on sustainability in terms of contraception. So Bayer is partnering with UNFPA globally, and we are initiating a very important tech-based project here in Chhattisgarh, Rajasthan, and Madhya Pradesh, where actually you spread a lot of awareness and about contraception, and also support them with the products. So this is how you choose partners. This is how you make the business of these programs more sustainable.
All right. What is the role of mass media, Khera ji? Social media is increasingly becoming more accessible to everyone because everyone has a mobile phone. But what is happening is a lot of misinformation is also going out. A lot of new myths are being created. When you're talking about busting taboos, new myths are being created. So how do you create that messaging which is believable and trustworthy?
No, absolutely, because at this point of time, people are facing, which is called as the infodemic, I mean, there is an epidemic of information. You are getting information through, internet, through WhatsApp, so-called the WhatsApp university. So people are now at this point of time totally confused. What is right, what is wrong? So that's why I think, and there are kind of organizations who have come up with a kind of a website or a place, where you can get the reliable information. So I think we have to bring out some kind of a system where one can capture that reliable information. I can talk about, the public health system. There are kind of, dedicated website where you can, download the right set of information. So that's the only way. Otherwise, as you know, the mass media can also be used. But nowadays, people are more dependent on social media. I don't know, nowadays I think there is a reduction in the mass media actually. People do not have enough time. People prefer to have the, customized social media products. They prefer to use it,
But Arundati, influencers have a big role. If Amitabh Bachchan will say it, a lot of people believe it. If Virat Kohli will endorse it, a lot of people will buy it. So should you also get the right people to talk about it? Is influencer marketing also important here?
I think so. I'm not a I'm not a big social media user myself, but I have seen Instagram play a huge role in young people's lives when it comes to reproductive and sexual health information. But we also have seen that along with the huge misinformation that happens to be there on Instagram, Twitter, WhatsApp, we also have some influencers who are doing a good job of breaking it down. You know, one example is there's a young doctor called Dr. Uterus. I don't know how many people follow her, but she's very popular and kind of bursts a lot of myths around reproductive and sexual health in a fun way, in a very informative way, and also in an open way. But I think, you know, we haven't figured out how to identify the right influencers. It's not possible for all of us to get Amitabh Bachchan and Virat Kohli, and because it's expensive. Not everyone can do that. So I think that we have to also, while we go after these heavy-duty influencers and large personalities, we have to also figure out who those local influencers are. And local it can be at a community level and it can be higher up. But who are those people whom government, large organizations, EngenderHealth, such a large organization, UNFPA, UNICEF, we've got so many of these large NGOs that exist, and how can they be responsible for, or how can they help us reach these other influencers, local influencers, community influencers, for them to impart, because they do exist, and do that. It's a hard job, but I think that we're seeing more and more capacity building of such people, young people as well as community leaders, to be able to do this. But it's a tough one. I think countering misinformation, I'm not sure I have the right answer, because it's an uphill battle. And with greater access comes greater, I think, greater confusion. And I think finding that space for correct, comprehensive, age-appropriate information, whether menstrual health, whether reproductive health, whether sexual health, it's a tough job. It's much tougher for us now than it ever was, I feel.
So I'm going to conclude this session, and I'm going to ask from each one of you to give me 3 takeaways. What can be immediately done which will give you the biggest bang for your buck? So let me start with you, Deepak ji. क्या कर सकते हैं अभी के अभी? ठीक बंदे को पकड़ ले, ठीक बात कर ले. क्या लगता है आपको? क्या अभी के अभी हो सकता है?
So right and credible information, yeah, and empowerment. So empowerment is nothing or something which you give. Probably you need to have a lot of education and awareness so that the person feels self-empowered and kind of take the right kind of information. So this is the quick take.
Khera ji, what do you think? 3 things, 3 takeaways, 3 things that can be done that will give the biggest bang for your buck.
The immediate, the action, we must, catch, all the, the women, the girls at the early age. That means catching young, And adolescent is the right period to catch. And if we really want to reach all adolescent girls across the country, the best place is the schools, Reason being, if you look at those data sets, they also indicate around 60 to 70% of the girls are now enrolled in schools. So I think if we can engage teachers, we'll be able to provide right set of information at the right age, That's all I think from my side.
And Arundati, what would you like to give as your takeaway?
I think immediately each of us have a responsibility that we begin to talk about these conversations, whether it's periods, whether it's reproductive and sexual health in our homes with our daughters and our sons. I'm the mother of a 9-year-old. I do talk to him about it. It's hard, but I think that my number one would be, let's talk about it to our children, to our nieces, to our nephews, and let's have those conversations. Second, I'm with Dr. Khera. I think schools are a very important platform for us to educate both boys and girls on the basics of their body. And third is that I think that, with adult women, many of us grew up, at least I did, without much information about the body. And whether it's in informal or formal work sites, I think it's also important for us to figure out how to have those dialogues. It need not be the employer's responsibility, although I think there is a little bit of responsibility there. But even as a woman in the workplace, whether you're a senior leader, whether you're a mid-career professional or a young starting out professional, get your colleagues together and talk about your health. It provides you that opportunity. So I think these are my 3 takeaways.
All right. Thank you all.
Just to add on what Arundati said. So we have launched this Bear for Her, a social media platform. since you spoke about conversation, so it is basically we talk about conversations for care. Yeah. So we have just initiated this.
All right. That's great. Thank you all for joining us in this important conversation on how everybody can be, companies and other stakeholders can be included to at least start talking about this very critical issue.